So just we'll just start immediately from what we have already talked about. How we go ahead and do it. Like the station, for instance, says like do an abdominal examination on this patient. All right. But with regard to hematological systems you've gone through, the primary thing is what? The liver and spleen examination. Exactly. Okay. So, but to do a liver and spleen examination, you have to do certain things before you actually get into the liver and the spleen. Good. So what is the first thing that you do in any station before starting your examination? Good. Introduce yourself, greet the patient. Yes. Get a consent. Good.
Make sure the environment is okay.
Those will come a little later.
The environment,
good.
Lighting,
make sure about the environment
privacy.
is yes, privacy of the patient. Good. You make sure you got the right patient. You stand on the right side of the patient. Yeah. You wash your hands. Right. Okay. So all that is the general thing you should do for all the examinations. Then the next thing is, yes, you can mention about the vitals. I would like to take the vitals of the patient, the height, the weight, and all those things you can also mention. But that's, again, more pertinent to the general examination. All right, regarding the abdominal examination, the first thing we said is, all the things that are done, now you're moving into the abdominal examination. What is the first thing that you do for? Inspection. Very good. So you're going to do the inspection. What's the normal position of the patient?
Flat.
It should be flat, exactly. It should be flat. In case of cardiovascular examination, we said it should be 45 degrees. 45 degrees. Very good. So, what is the normal exposure for the abdominal examination?
Mid-chest and mid-thigh.
Good, good. So you're starting from the mid-chest, just below the nipple, all the way to the mid-thigh. It has to be that region. You're going to examine all the entire area. But for the purpose of the patient's privacy, we'll cover the inguinal regions, and then once we finish the abdominal examination, we'll move down into the inguinal and the perineal regions. All right, great.
The exam, do we have to say that we normally expose them?
Yeah, yes.
But we don't have to do it.
But you shouldn't, yes, you'll mention that the normal area of exposure is from here to here, but for the purpose of the patient's privacy, we'll just cover this area. Great. Right. So, what are the things you look for in the inspection of the abdomen?
Any swellings?
Okay.
Scars.
Swellings, edematous, yes. What else? Pigmentations, yes. Yes. Pulsations, yes. What else?
Veins.
Dilated veins, good. Yes. What else? Scars, yes. Scars of previous operations, yes.
Normal breathing.
Good, yes. Very good. Normal abdominal movement with breathing, yes. Yes. What else? Caput medusa, that's dilated veins around the umbilicus, good, yes. What else?
Symmetry, but it's not like...
Yes, the position of the abdomen and the shape of the abdomen also is important. Is it distended or the normal contour? Is it a scaphoid or just, okay, yes. Yes, if there's any swellings around, okay, what else? That's it. What else? Any edema? Well, no. If there's an ascites, you will see like the flank regions are full. You can mention about the contour. As part of it, you can say yes, the flanks are full. What else? That's all? What distribution? Hair distribution, yes. So hair distribution is also important. Normally in male, yes, looking at the suprapubic region, what is the normal hair distribution in male? It is triangular. The pointing is toward the umbilicus. The base is located inferiorly. In females, it is the other way around. Yes. So you've got the base in here. It's pointing downward. Okay. What else? What else to look for? What else? Is that all?
Yeah. Oh, the umbilicus?
Yes, exactly. You've got to look for the umbilicus. What are the things you look for in the umbilicus?
Discharge.
Position of the umbilicus. What we call a protrusion? Hernia, yes. So we'll look for the hernia or orifices, right? We'll talk about them later. What else in the umbilicus?
Discharge.
Any discharges? Good. Yes. What else? What?
If it's pushed to the side.
Yeah, the position, as we said, yes, the position. If there is a mass, from suprapubic regions, then it will be pushed outward. If there is an epigastric region, yes. Yes, please.
Can I speak to Scott?
Yeah.
Thank you so much.
Yeah. What else? So in the umbilicus, if there are any signs of inflammation, redness, right, dilated veins, all that. Now, with regard to pulsation, how you look for a pulsation, and where you will look for a pulsation? The pulsation, what's the commonest area of pulsation? Yes. Which area of the abdomen? Yeah.
The midline.
Midline, yes. Here?
In the umbilical region?
Yes. So here you will see the pulsation of the aortic aneurysm. If you've got an aortic aneurysm, you will see it in this region. But you've got to bend all the way here and then look for the area of pulsation, because if you're standing actually at this level, you might not really see it exactly. So that's where you stand and you look for the pulsation in this region. Right. Anything else? Anyone said hernias? Yeah. So what are the areas of hernia? Umbilicus is one. Femoral, good, and inguinal, very good, very good. The commonest site of hernias in both male and female, it is inguinal. Yeah, inguinal. It's in the inguinal region. Yes, so we've got to expose that area a little bit. Anyhow, we'll ask the patient to
cough.
We'll ask the patient to
Look away and cough.
To cough, right? So can you look at that side? Yeah, and ask them to cough. Cough, please. Cough. Yes. Okay. So you look if there's any areas of hernias as well. You see, you look down, in the inguinal region, in the femoral areas. So in the inguinal areas and the femoral areas. Then what is the other side? What is the other side of hernias? Of hernias. We said. No. Yes. What else? And we've got the divercation of the recti. Divercation of the recti, right? The recti will divergate, will give way. So how you examine that? You ask the patient.
To sit up.
Yes.
Yes.
Can you sit up? Can you sit up? Sit up, sit up, sit up, sit up, sit up, sit up. Yes, very good. So you see if there is any area of, okay, that's fine, that's fine. If there is any divergation, it's going to give way and it's going to pulsate up. Alright, so they should not use their hands coming up, right? It should be the contraction of the abdominal muscles. Good. Alright, so those are in the inspection. Anything else in the inspection? Anything else? Anything else? Nothing else? Sometimes you got to look for the angle of the subcostal angle as well. So you can look for the subcostal angle. It has to be acute. If it's obtuse this way, it's a sign of no, the pectus excavatum, you'll see it in here. Barrel chest, good, barrel chest, yes. In emphysematous patients, you will see that the chest become barrel shaped and then the angle will become more obtuse. That's very good. Anything else in the inspection? These are pretty much what you have to look for in the inspection. So you mentioned that all those things are not there. Okay? Alright, so with regard to the palpation, the next thing is palpation. We said that in the American system, you do an inspection, then do auscultation, then palpation, then percussion. But in the English system, you do an inspection, palpation, percussion, last auscultation. Alright, so we are here doing the inspection palpation next. So for the palpation, what's the first thing that you have to do?
General.
Warm your hands. Warm your hands.
Warm your hands. Warm your hands. So we said already, wash your hands. Before any examination, you wash your hands. But with regard to starting the abdominal examination, warm your hands. And the next thing is?
Ask the patient to tell you if he's got any pain.
Pain, good. So always before touching the patient, do you have any pain? Do you have any pain? And ask them to point if there's any pain. And if there's any pain,
start away from
the site of pain. Start away from the site. The most remotest area from that region of pain. Okay. So for instance, in this patient, he doesn't have any pain. Okay, great. So once you're palpating, you're gonna palpate with the entire palm, Yeah, it should not be only fingers, not like this. That's totally wrong. That's totally wrong. And they should be all closed. You should not palpate in this way. All right, so with your entire palm. And what do you have to look for?
For if you can feel any pulsations or.
Yeah, but while palpating,
you look at his face. You look at his face.
Yes,
any signs of pain.
Yeah. So look in the face of the patient and see if there is any pain. Right? See if there is any pain. Yeah. Okay.
Nope.
He doesn't have it. Right? So at the same time, you're going to cover all that area. So that's in the G shape or S shape. You know that, right? So you're going to start from here, go all the way here, and then you come here.
Okay.
Yeah. So that's how you're going to go ahead. All right. So the superficial palpation done. The next thing is what?
Deep
palpation. Yes. In deep palpation, ideally, you have to actually go and look for if there's any mass or thing like that. We'll talk about it later on. But now the next most important thing for us now is liver and a spleen examination. Liver and a spleen examination. How are you going to look for a liver?
You have to find the liver, the top border.
Find the top of the liver? Percussion?
Yeah. Well, sometimes, as we said, you can do palpation, all the palpations, and then go with all the percussions. That's totally acceptable. Or you can look for the span of the liver before you actually go and feel for the liver. But any way that you're comfortable with, just do it in that way. As far as you don't forget that you cover everything. So for instance, now I'll just move and find out the lower edge of the liver before I go in the percus. Okay? So you're going to start at at
The right
yes,
iliac region.
right iliac region. You're going to start it. And what do you ask the patient to do?
Breathe in.
Breathe in and out.
Take